Hey guys, it's Jenny. I hope you're all doing well. All right, let's talk about video number 2. How to work through fear, trying new skills, assignments, etc. Yes, I have found myself there. Whew, I would have to take a couple deep breaths, go walk to my patient's room and take the report. So first thing is first, positive mindset. Yes, you will feel that fear, that anxiety. That is there to check you, to make sure that you are thinking about all of the possibilities and making sure you're making the best judgment, the safest choice, the safest actions for your patients. As time goes on, and repetition also helps in further studying, further reviewing, discussing, going through learning or educational moments, that is what will grow you. So I want you to, as whenever you find yourself in that position, I'm feeling really anxious, I'm just fearful, I don't even want to do that, I don't want to try that. I want you to take a couple deep breaths, go talk to a nurse that you look up to, that you trust, like, hey, you know, I have to, let's say if you haven't put a Foley in, maybe it's your first Foley ever, I need to put a Foley in, do you mind assisting me? Or I just want to run down how to do that. And this goes for the students as well, like, hey, I'm about to go check off on my assessment, I've gotten this before with my instructor, can you help me? Okay. So let's go in there and do the assessment together. I will provide, as the nurse, feedback so you can improve and prepare. So when you are ready to show that to your instructor, we've identified certain things that you can improve on. And that's why you're in a clinical setting. So I want you to just acknowledge that those are normal feelings that you will feel throughout your nursing journey. And then flip it so you know that it's going to fuel your motivation to learn, to improve, to grow as a nurse. So common things that I see, you know, a lot of nurses, we write down, let's say we have like a little brain book, things that causes anxiety in terms of like reminders. So let's say let's stay with the Foley, if I always mess something up, or it's a common thing that I see whenever I do it, then just write it down somewhere. So whenever you come across that opportunity, let's say you have to put in a Foley, you know, go ahead and glance at it. Use your resources. I don't ever want anyone to feel like, oh, I'm a nurse, I'm a working nurse, I have my license, I don't have to look at references or resources. Absolutely not. That is how we make mistakes. So go back, look at the skills, read the skill list, then work through it, then try it. That's the worst thing that you can do, is after doing all that, after talking, after reviewing, researching, and then you, I don't want to say chicken out, but you chicken out. You have taken away a learning opportunity from yourself to grow. So I really just encourage you, find someone you trust and then just work on that. And I promise that will go away, or at least improve. And next thing you know, you find yourself, okay, hey, I'm gonna put a Foley in. There's no more anxiety. You know what to do. You feel confident in your skills. So I will say there are moments where let's say patient status is changing rapidly. Can you keep up? The adrenaline that will come from that will give you the energy to get through that moment. But if you ever find yourself, let's say after a difficult patient or situation, I have found myself needing to do this. So finally the patient stabilized and I haven't eaten lunch. It's about 3 p.m. Once they're stable, I go to my nurse buddy, hey, I just need 5 minutes. I'm gonna go to the break room, grab some coffee, just sit and regroup. That is okay. You will find yourself doing that. I really encourage you to do that. We as nurses go through a lot of emotions, a lot of trying emotions in situations. We are human too, so make sure that you're doing a lot of self-care. Even after, let's say when I was on orientation, if there were certain things that were causing me a lot of anxiety, I just wasn't sure, I felt better going home and reading up on it, and then I can come back, talk to my preceptor, and then that will help me to reduce that fear or that anxiety, or just clarify things. That just made me feel better as I progressed, and you know, I completed my orientation. Even on on my own. So just acknowledge it. Take a couple deep breaths. Go speak to someone you trust. If it's something you need to review to improve your knowledge and your confidence, go ahead and do that, and just keep coming back. Always think about your patient. Make them first, safety first, and then I promise everything will get better for you. All right, thank you guys so much for watching. Don't forget to comment, like, and subscribe, and share the videos. Bye.